We are going to be focusing on medical imaging. I would like to explain the differences between the basic imaging principles. This is Röntgen. He is the guy who discovered the use of X-ray. X-ray was announced as a discovery in 1895, and then January 1896, there was a guy with some needles in their body, and they have an image of it. And 1901, Röntgen got his Nobel Prize. See this image here? This is the image of his wife's hand with the ring. And people are saying that this is the first viable X-ray ever made, actually, and reconstructed. We're talking about 1895. And we're in biomedical engineering. What is the main use of imaging? Diagnosis, right? So that's the most important one. In the 1600s and 1700s, do you know what was the life expectancy of people in Europe? So, what do you think the life expectancy today in Europe and the West, in the US? It's 85 to 88, something like this. What do you expect that was in 16 to 1700? 45. Imagine the life expectancy for someone to live is 45 years. So there are two main reasons for this low life expectancy. Do you know what they are? One of them is 90%, account for 90% of deaths. The first one, which accounts for a lot of it, but not that much, is giving birth to babies. They were dying immediately. 90% of deaths are account because of infection. So if someone has a cut for any reason, they get infected, that thing propagates and they die. What did fix that high rate of mortality? Penicillin. And then everything was fixed and covered for that. Now, what is the relationship between penicillin and biomedical engineering? Without being biomedical engineering, this would not even happen. You need to do mass production. So it was an engineering problem to create this using yeast. That was the reason why it was cheap and abundant to help people. Without the engineering and the production lines, it was impossible to do this. And the same thing happened for imaging. Physicians before medical imaging, how do they diagnose? What they were doing to diagnose someone? Touching and feeling the subject and looking at the color of the skin and the eyes. It's all what they have. And then we had this way to look at the human body internally. So when you look at an image like this, you are looking at the structure, correct? So we're looking at the structure of the internal organs of the body. There is another achievement that we did, is looking at functionality. Which modality do you think looks at the function? PET and SPECT, which is nuclear medicine. So we had, Miss Curie, she got the Nobel Prize, and Miss Curie was working with the isotopes of the radioactive isotopes. Some of them, she is the one who identified that some of them are safe and they can be linked to proteins. Way before anyone else even thought about the nuclear imaging. So there we have these isotopes that you can inject in the body, and these isotopes can go. Do you know what was the first application for these nuclear isotopes? The thyroid gland. They're going to the thyroid gland, attached with it, and then you can look at the functionality, if it's functioning or not. So now you have two things. This X-ray is structure. The nuclear medicine or imaging is functionality. So we are not only looking at the anatomy and physiology, but now we're looking at the biochemistry, how proteins are actually interacting. So this guy, Röntgen, I feel bad that I'm unable to pronounce his name in German, but he did the X-ray. But here's what he was looking at. He said, well, I'm going to get a source of electrons, right? And then he did an optically opaque, how do you call it? Opaque? Opaque, which means that it's not transparent, right? So he said, well, these electrons are going to be blocked. And then he did phosphorescent glass behind it. And he said there's no way for these, you know what's phosphorescent? That it absorbs something, daylight, and when it's dark, it emits it again. It's a fluorescent, lights. So he said, well, there is no way for electrons to pass through this. But what he discovered, that what he made did not have reflections, they didn't have any refractions, and they did not stop by the mirrors or all the fluorescent. So everything, all these electrons, they passed through it with a straight line. There's nothing that affected these electrons that passing through the whole thing. Now we know that there's something called small particles, and Einstein is the guy who said, well, we are going to call light as photons. So it's not a wave. Einstein is the one who came up with this idea. And then that guy was saying, well, these photons are the ones that they're creating the X-ray. They didn't know what they are at the beginning, but that's what they were thinking. So X-rays are not electromagnetic waves. They're particles. They penetrate materials. And if you have a film on the other side, then you can get the image. Now, here's the thing. The image that we're seeing in X-ray, it's a negative image, which means that if you look at an X-ray, you see that you have a white, the bones are white. No, they should be the darker because they're absorbing the photons, but they negative it, flip it. So the white areas in the X-ray are the areas where it was absorbed. So it should be dark, but they do the negative. That's why they call the negative. You probably did an chest X-ray. So you can see the bone, but do you know that you can see also in the X-ray a big void, a black void. Do you know what that is? The lungs. Why do you think the lungs are black? It's air. It does not absorb anything. But there's also on an X-ray, if you do check any chest X-ray on your computer, you will see that the heart is also bright. Why do you think that? Anything that is thick, it absorbs X-ray. So it's not just the bone. It's also any tissue that is like muscles and thick muscle tissue and liquid. It has a lot of liquid, so it's not void. It absorbs actually X-ray and it shows there. And when we look at the X-ray, you look at the heart and the ribs, the bone. We look at if there is infection in the lungs, because if you have infection in the lungs, it means that there are liquids in the lungs. You have these white dots in the lungs. And the most important thing for cardiovascular disease, do you know the aortic valve, those coronary artery, the one at the top? Those are also show that they are bright in X-ray. So if there is a blockage in them and in the valves, you can see it from X-ray. See how much it helped people? But what is the problem with X-ray? It's something we call projection image. It's a 3-dimension collapse on 2D. Because if the heart is overlapping with the chest, that's going to be bright as well. So you block the heart because of it. So it's a projection imaging modality, and that's a big challenge. What is CT? Instead of rotating yourself, we rotate the electrodes around you, and you get X-rays from different angles, and you build the 3D structure. So X-ray is a projection imaging modality. CT is a 3-dimensional using X-ray. So it's the same X-ray but different angles. People, if you want to use, the same planar X-ray machine, you rotate the subject. But if you want to keep the subject and rotate the electrode, you have a CT scan. CT scans are X-ray scans, but they are in different angles to overcome the projection of the 2D, or the 3D on 2D. So here's what happens. So let's say you have an X-ray source, right? And you have this tissue in the middle. All what the X-ray detector is looking at is something we call the attenuation. How much was it absorbed, correct? So if the bone is absorbing a lot of X-ray, you will end up with high attenuation, correct? If you have air, you don't have attenuation, right? You have low attenuation. So all what we are looking at is something called mu, which is the attenuation coefficient, and it's tried to put it as a geometric representation because you're looking at positions, right? So that's anatomy. That's not function. We're looking at places, locations in the X-ray. So you measure the attenuation. I'm not going to go into the integration. We'll come back to it later on. But the disadvantages, its depth information is lost. It's 2D, it's projected, but it's cheap and simple. Now, what is the biggest problem with this one? These images, you probably learned this from physics, they do ionize the tissue. So it can damage the proteins. And if it damages the proteins, it means it can damage the DNA. If you damage the DNA, it means it's going to result in a cancer. If your immune system did not clean the damaged, you know, polypeptide, the DNA strands. So if you are exposed to high radiation, you will end up with problems with DNA, and that could result in cancer. And that's the problem with the nuclear weapons. So when you have a nuclear detonation, who died. The problem with people who stay alive, but they are exposed to the radiation, and they're slowly getting sicker and sicker with time. That's a problem. Okay, so this is an X-ray, again, projection. See this image here? That's the creation of two-dimensional projection. That's projected images. That's what we call them. And see this X-ray? See the heart? See, it's white because it's muscles. It's absorbing, just like the bone. And you need to look at the aortic valve, the coronary arteries on the top, and that's an X-ray. See this lung here? The cleaner the lungs, the healthier the subject. If there is any kind of infection, like what happened with COVID, it's all white. So when you take an X-ray, it's just like it's all bone, and that's because of fluid and liquids in the lungs. They're unable to get it out. Now, remember what did we learn to call the coronal? The frontal axis, right? And then you have the sagittal on the left and transverse in the middle, right? So that you need to make sure that you know these when you do the X-rays. We have three standard orthogonal tomographics. You know this. So axial, and then transverse, coronal, frontal, and the sagittal. So we know these methods. And it's important with the X-ray. Now here is an image. So the 1A is computed tomography, which means it's X-rays, but they're made on different angles, correct? The most problematic part of these machines is the movable parts. You need to keep changing these things, and you get damaged. So this is the CT. This is an X-ray, but different angles that give you, instead of project 2D, you have a 3D, and it's a slice, right? It's a slice of the brain, and you can have multiple slices. The CT scans. Now this one here is an MRI, and MRI is dependent on hydrogen, which is water in the brain. So what happens is that you expose the body to a magnetic field. It rotates the hydrogen atom. The hydrogen atoms, they rotate, the electrons. They rotate in a specific direction, and they're tilted because of the magnetic field. And you then turn off the magnetic field. They have to go back to where they were originally. When they go back, they emit radiation, and that's your MRI. And we're going to learn more about the machine, not the physics, the machine of these components. So you put a subject into this tunnel, and you have a magnetic field. Everything will tilt, the hydrogen, which is water, and then they come spinning, and then you turn it off. They have to go back, and then turn it on. They keep going back and forth, and with how much water and how much hydrogen, you will have different gray scales. And then you can say, well, this is the cortex, this is the, the inner part of the brain, and that's how you get your MRI. The magnetic resonance imaging, it's not that this is an anatomy and physiology, right? This is based on location. But you know something that is called functional MRI? So which means that if I'm doing the imaging and I'm doing this with my hand, some parts of the brain will have more oxygen. They need more oxygen. So the concentration of oxygen and water will change, and then it will light. It will have a different color. So that's another functional way of looking at the functionality of the inner, parts of the body. Now this one here is positron emission tomography. Do you know what that is? Do you know what a positron? PET scan. Do you know what's a positron? No. So the positron is is just like one of these subatomic particles of the atoms, and these positrons get emitted, right, if they are excited in the body. And what happens is that you will have, let's say, let me draw something. So let's say you have a nuclear isotope that was injected into the body, correct? That nuclear isotope went into the thyroid gland. In the thyroid gland, that isotope is going to be interacting with a specific protein. When that happens, two positrons will be emitted in opposite directions. So instead of having, the traditional nuclear imaging where you have injected someone with a radioactive material and it went into, let's say, on the heart, and you have a detector that is looking at the emission from one direction, you have a circular detector, and it's now detecting two positrons in opposite directions. So now you have more precision where exactly that isotope is. Does that make sense? And that's called positron emission tomography. Again, it's like a circular electrode, and something happened, and then you have two positrons going in both directions, in opposite directions, and you do detectors will exactly know where is that happening. And that's another way of looking at biochemistry and functionality. So what the take-home message? Imaging is not just for looking at the structure of the human body, the anatomy. You need to look at the functionality, the biochemistry, what's happening in the body. There is there's one more imaging thing, modality, which is related to genetics. So there is something called genetic microchips. So you'll have a drop of blood, and you inject it on a nano microchip, which has a lot of wells. Each well has a specific DNA. When you put the blood in it, some of them will be yellow and some of them will be red. The red ones are the upregulated genes. So it's not enough now to know what kind of genes do you have. We need to know now which one of them is upregulated, which means is working, and which one of them is downregulated, which means suppressed with that. So that's another imaging modality that we are doing for functionality, but not functionality of proteins in biochemistry. We're looking at functionality of the DNA. That's the future. And now these days, all these rich fellows, Elon Musk and Jeff Bezos, all those guys, they're all working on something called digital biology. That's the new thing. That's something different. But they're trying to do this, the genetics, by digitizing our DNA upregulations, down. So it's useless now to know that I have a specific gene. I need if that gene is upregulated or downregulated. Who cares if I have a gene for diabetes? They need to know when that thing will be activated. And that's another imaging modality. So I wanted to keep in mind structure, anatomy, functionality of the proteins, the biochemistry, and functionality of DNA. That's medical imaging. And we're going to talk about all of these types of things. Okay. We have intensifying agents, contrast agents. So you have some agents like Miss Curie, which she did the nuclear isotopes, but we have biochemistry agents like dye that now we can use to attach with the proteins. Guys, this at the beginning it was physicians who come up with these ideas, but when they start looking at 2D, 3D, and functionality, now it's a playground for physicists and engineers, and that's why we need a large population of physicians who are actually engineers first. That's why we want the pre-med pathway so that you can go into medical school. Now, orally, intravenously, so different ways of how do you administer these. Now here's when things start becoming really, really good for medical imaging. So in 1940s and 50s, so that's not far away. So we have background laid for ultrasound and nuclear medicine. So what is the, ultrasound is based on vibration and reflection and diffraction. So if you are having an transducer, when you have different layers of tissue, some of the signal will be reflected. And that's how we are looking at ultrasound. It's safe, cheap, and it does not ionize the tissue. That's why we use it for babies, to look at the pregnancy, the stages of pregnancy. So ultrasound is important, and I'm going to spend a lot of time on it. Nuclear medicine is also another breakthrough. Without Miss Curry, none of this will happen. Now, then we have ultrasound and nuclear medicine together, and I'm going to show you some things. Then computerized tomography, which is CT, which is an X-ray, but multiple, angles. And then we have the 80s MRI and the PET, positron emission tomography. And the 2000, we now have CTs and PET together. So I can have a CT scan with it at the same time. I can look at where things are happening. So you have geometry, structure, and functionality in one image, which is really, really amazing to look at. Guys, this is 2000. This is 20 years ago, 25 years ago. So the whole thing is just exploding. And we need a lot of medical imaging specialists. Now, people will hate it because of the math and because of programming. But there is no way around it, especially MRI. They all have to be partial differential equations to be solved to get the values of the hydrogen spinning, the attenuation of these things. But that's for another day. Let me show you some pictures. We know what that is, right? That's X-ray, correct? We good? Now, B is a gamma ray emission from within the body. So this here, see these two black dots? So this is a dye that was injected into the subject, and I'm looking from the top. Now, it's 2D, right? And I'm relying on the emissions from the isotope. Now, this resolution is very low. See, you can tell that it does not give you a lot. And the other thing about it is that because it's radiating, it's like you have a light and emitting, you cannot see what's happening on the sides because it's bright, it's very bright. So we need to be able to have the 2 points from the PET, the positron, to identify exactly where that thing is. Now, this is an ultrasound, correct? Now, this one here is the nuclear magnetic resonance, which means so that you have a CT scan as well as isotopes. You can't see them here, but they can change the colors. I think this is one of they're looking at the thyroid, and one of them, the isotopes in the thyroid, the nuclear isotopes in the thyroid. Now, I will stop here, but I want to point one thing. X-ray, this is what we call it. X-ray is called projection radiology. We good? X-ray is projection because it's 2D. Now, gamma rays is called planar scintigraphy. That's what it's called. So we don't call it nuclear imaging. Now, ultrasound imaging is ultrasound. This one here, when you have two modalities at the same time, we call it magnetic resonance imaging, even though that you have a nuclear isotopes in it. So we're going to talk about projection and the planar scintigraphy and ultrasound and the magnetic resonance imaging. So these are the 4 things I'm going to cover in the first part. I'm not going to focus much on physics because that's a different story. I will focus on systems and components. You good? Thank you so much. I think we are off for a good start.